Hello everyone, welcome to 2023 20th question. Which of the following is false regarding the anatomy of adrenal glands? First option, the right adrenal gland is semilunar in shape. Option B is the left adrenal gland is closely related with the tail of pancreas and spleen. Adrenals are yellow on gross appearance. Adrenals are retroperitoneal in location. The C and D are yes correct, but they have asked which is false. The left adrenal gland is closely related to tail of the pancreas. Yes, the adrenal gland comes with the tail of the pancreas. But the right adrenal gland is pyramidal in shape, whereas left adrenal gland is in semilunar shape. Okay? Yes. Okay. Coming to the 21st one, the anterior relations of the third part of the duodenum are all except. First, let's see the picture. This is the third part of the duodenum. Here you can see anteriorly superior mesenteric vessels, root of the mesentery, and you can see the anteriorly coils of the jejunum, and inferiorly also you can see the coils of jejunum. Whereas posterior relationship is right psoas major muscle, right ureter, right gonadal vessels, and inferior vena cava, abdominal aorta, and inferior mesenteric artery. These are the posterior relations. These are the anterior relations. Whereas superior relation is the head of the pancreas. Whereas inferior relation is coils of jejunum here. So you can see the fundus and body of gallbladder is not in relation to the duodenum, whereas superior mesenteric vessels form the anterior relation, whereas lobes of jejunum forms the anterior and also some are in the inferior. The root of mesentery also forms in anterior. Okay, 22nd question. Which of the following statement given below regarding the muscles shown in the image are correct? Here they have shown rhomboides minor and rhomboides major. They retract the scapula along with middle fibers of the trapezius. Yes, they elevate the scapula along with fibers of trapezius. Yes, they rotate the scapula, tilting the glenoid cavity inferiorly. Yes, they rotate the scapula, tilting the glenoid cavity superiorly. No, this is wrong. Let's see. Rhomboides major and minor, there causes retraction, elevation of scapula, and also rotation of the scapula, tilting the glenoid cavity inferiorly. They have given both the options, inferiorly and superiorly. So the glenoid cavity will go inferiorly, hence fourth option is wrong. Then everything is right, hence option A, 1, 2, 3. The rhomboides major and minor is supplied by dorsal scapular artery and innervated by dorsal scapular valve. Till now we have seen all the questions which are twisted PYQ. Some are direct questions. I have put all these three questions together because these are the exact repeat of the previous year questions. Okay. 23rd one, which of the following muscles are supplied by superior gluteal nerve? Okay, superior gluteal nerve, gluteus medius correct, minimus correct, tensor facial lata correct, but it is not supplying the piriformis. Piriformis is a hero who has separate nerve, that is nerve to piriformis. Okay, hence the option 4 is not there. Only left out is C. 1, 2, 3. 24th one. The patient came with a complaint of inability to move his fourth and fifth digit and cannot hold pen, and he is not able to hold the paper in between the finger. That means his palmar interosseous is injured. Which of the following site given below is probably injured? The fourth and fifth digit are supplied by which nerve? You can see this is the palm. Okay, this is thumb, this is the little finger. The fourth and fifth digit is supplied by ulnar nerve. Okay, hence, and palmar interosseous is supplied by also ulnar nerve. Hence, ulnar nerve is present in the medial epicondyle. How to know this is medial or lateral? It's because neck of the humerus is corresponds to the medial side. Hence, it is B. Option B. Can see this neck axillary nerve. Radial groove has a radial nerve, whereas medial side has a ulnar nerve. Whereas if it is lateral epicondyle fracture, then there will be tardy ulnar nerve palsy, that is stretching of the medial side ulnar nerve. Okay, this is two times repeated already, 2021 and 17. Okay, coming to the 25th one, which of the following muscle forms a pelvic diaphragm? Okay, this is actually repeat of 2022 paper. Iliococcygeus and pubococcygeus. That is A and B are the answer, which forms a pelvic diaphragm, that is the levator ani muscle. Can see levator ani muscle, which has a three muscle components, that is pubococcygeus, iliococcygeus and puborectalis. Pubococcygeus has a three component, that is pubovaginalis, puboperinealis and puboanalis. Okay. Which muscle does not constitute? That is ischiococcygeus is not a component of this. Whereas pubo and iliococcygeus comes here. Okay. Which is the option here? A and B. Okay, we have completed 2023 paper. Currently, we are left with 2024 and 25. Let's finish that as soon as possible. Happy studying. Thank you all. Be healthy. Take care.